Okay, so let's look at some 12 leads and let's use RPM ABC. The first thing is R for rate, and I'm going to blow this up a little bit so that we can calculate the rate. And we're going to see that we have 300, 150, 100, 75, 60. So it's a decent rate. Nothing scary about the rate at all. And so then we go to the rhythm, and the rhythm looks very regular. And now we're going to look at P waves and parts. And I see P waves in the limb leads, and they are upright or isoelectric except in AVR, and it's flipped, and that's supposed to be right. So that's a sinus P wave. And then we're going to look for measurements. And the first thing is, do I see any PR intervals that are long? And no, I don't. And then I look for the QRS. I don't see any wide QRSs. I look in every lead. No wide QRS complexes. And then the next thing on measurement is the QT interval. So again, I think I'm going to blow that up for us to take a peek at. And it's very clear from this blown up version that the QT interval is less than half of this R to R interval. And so really pretty benign as far as R, P, and M. On axis, we take a peek at axis, and we have a positive in lead 1 and a negative in AVF. So I have my left thumb up and my right thumb down, and that gives me left axis deviation, but that can be either pathological or physiological. Physiological would mean that in lead 2 the complex is upright, but it is negative in lead 2. So I do have a pathological left axis, and so that can mean, among other things, a left anterior fascicular block, and as far as conduction goes, that's what we're looking for. Again, no wide QRS, so bundle branch is out. And so that's RPM AB, and now we're going to look at C. We're going to look at changes. And do I see any strange looking T waves? Do I see any deformed upslope on any T waves? And I don't. Do I see any ST elevation or depression in any of the leads? And so really, I don't see anything on RPM ABC. The only abnormality in this sinus rhythm would be a left anterior fascicular block, possibly. So that's RPM ABC for case 1. Now here's case 2, and on case 1 I went a little bit slower than our standard. So I was trying to explain things. I can think a lot faster than I can talk, so it's going a little bit slow. On this one we'll also go at a reasonably slow pace. And so the first thing we look for is rate. And again, I'll blow it up and then use my pen. And I see 300, 150, 100, 75. Again, a pretty normal rate. That's certainly a markedly widened QRS, however. So I'm going to definitely look for bundle branch block when we get there. But for now, we're going to look for P waves. And we see those in 1, 2, 3, AVL, AVF. They're all upright. It's negative in AVR, so it's a sinus rhythm. And it's very regular. And the PR intervals are all good, as far as I can see, looking at all the PR intervals. And then I'm going to look at the QRS measurement. And again, we said that was wide. And let's look at a QT. And blow it up again. Look at a QT. And to the naked eye, that doesn't look like it's too long, but it might be. And so here's my R to R. And my R to R is 1, 2, 3, right at 4 boxes. And so then is my QT interval more than 2 boxes? And it is. And that's why you don't pay attention to your naked eye. You go ahead and measure these things out. So we do have a little bit of a lengthened, prolonged QT interval, which makes us a little bit concerned that this patient might be at risk for some torsades. And so we have R, P, and M pretty well done. Now we're going to do A, B, and C. Axis-wise, we're upright in 1 and AVF, so axis is normal. B, we have a widened QRS, and in lead V1, we determine if it's left or right. Well, it's from the J point backwards is primarily left. So I have a left bundle branch block, and then I need to remember that I have a long QT, And so now I'm going to look for changes. I'm going to look for ST Solomon elevation, depression, flip T waves, and we certainly have a number of flip T waves that we might be interested in here. And again, I'm going to try to blow this up and see if we have ST elevation or depression. And even though we have this very wide, very ugly QRS, I don't see marked ST elevation or depression except in V1 and V2, and in the presence of that left bundle branch, it can't really do much with that. Now, we haven't talked about Sgarbossa criteria. We'll do that later, deeper into the course. But just quick and dirty on that is that when you have this complex that is negative, the J point should be elevated. If it were not elevated, if it were depressed, that would be abnormal. So that's just kind of quick and dirty. Don't need to know that for the first unit exam, but I just wanted to throw that in while we were here, that we will be dealing with how to look for injury, ischemia, and infarct in a left bundle branch or pacer pattern. So the analysis on this is we have a left bundle branch, and we have a prolonged QT interval, and we have a number of flip T waves with a pretty wide QRS that goes along with that left bundle. Okay, I want to speed up and go faster. We're going to do this one in a minute. First thing we're going to look at is rate, RPM, ABC. So I've got 300, 150, 100. It's between 75 and 100. It does not appear to be irregular at all. So P waves and parts, I've got P's everywhere. Every P has a QRS. There's no drop beats. The PR interval looks good. The QRS looks good. The QT to the naked eye might be a little bit prolonged, mostly because it's hard to see where that T wave is, but I would say we do have a prolonged QT. Now we're going to look for axis. It's upright in 1 and it's upright in AVF, so there's no axis problems. It's not wide, so there's no bundle branch issues. I don't see any ST or T wave changes anywhere on here, so really all I've got is a prolonged QT, and otherwise a sinus rhythm, borderline sinus tach. Okay, going through this one pretty quick as well. I'm going to look for rate here, and I see 300, 150, 100, so it's pretty much right at 100. I'm looking for P waves, and I see P waves that are upright and all look the same in 1, 2, 3 AVL, AVF, upside down in AVR, that's normal. There's R, and the rhythm is regular, and the P's are normal. And so now I'm looking for PR intervals. They all look to be pretty good. Now I'm looking for wide QRS, and I don't see one. Looking for a wide QT. Again, I'm going to blow it up here, and I'm going to say no, we don't have a wide QT. Now I'm doing axis. It's upright in 1, upright in AVF, no axis issues. QRS is not wide, so there's no bundle branch issues. And now I'm looking for ST elevation, and I find it very definitely. A little bit in V1, some in V2, V3, V4. And so what I've got there is ST elevation consistent with ischemia in the septal and the anterior leads, and that's it.